Hello, Ryan Thompson here at United Community Health Center on West Milwaukee and Storm Lake, and visiting with the new CEO here at the medical center, Brad Meyer. Brad, thanks for joining us. How's it going?
It's going good. How about yourself?
I'm doing fine, and you've been on the job for how long now?
I started January 3rd, so about 6 weeks now. So.
Okay, so how's everything been going so far?
It's going good. I enjoyed it. It was a good move for me, and enjoy the people here, and it's nice to be back in my home area.
Yeah, you are from the area, correct?
I grew up in Quimby. My dad worked for a feedlot over there, and my mom and stepdad live in Lakeside here in Storm Lake. So yeah, I'm originally from the area. Just I moved out when after I graduated, and have lived in several different places: Des Moines, Sioux City, Sioux Falls area, and so now I've come back home.
Okay, and you studied at Bellevue University in Nebraska. What got you interested in healthcare?
Well, I originally got my undergrad in criminal justice, and I worked at the Boys and Girls Home for 5 years, and during my tenure there, I joined a volunteer fire department, got my EMT certification, and I had an opportunity to go to Hawarden, Iowa, to manage an ambulance service there, and that's kind of when I got hooked on healthcare, and worked there for 3.5 years. Decided I liked management and I liked healthcare, so I ended up going back for my master's degree. While during that time I transferred to or switched jobs to Orange City Hospital, so I could get more clinical background. We worked as paramedics. We worked in the ER and pretty much throughout the hospital, so I had a lot of good experience there. And then when I was about ready to finish my master's degree, I got a job down in Des Moines managing some clinics down there, and worked down there for a couple of years, and got a job with Sanford Health as their public health administrator, kind of moving up the ranks, and was the public health administrator for Sanford Health out of Worthington, Minnesota. And then in middle of the year, middle of 2010, I found out my job was going away, so I started looking for jobs and saw this opportunity, and I was like, it's meant for me. So
jumped at the chance to come back to your home area.
Yeah. You always have some reservations. Do I really want to move back and stuff? But no, it's a good fit. The people here are great, and of course, my parents are glad to have me back in the area. So
I'm sure so. So what is your view on United Community Health Center now that you've been here for a few weeks, and talk more about the staff that you deal with?
Well, United Community Health Center, we have a medical clinic and a dental clinic. And so we have about 18 people that work for us. On the medical side, we have a medical director and a staff physician, Dr. Michael Diener. And then our nurse practitioner is Carla McFarland. They both started at the end of January and the beginning of February, so they're new here too. And then we've got 2 nurses. We've got full-time interpreter on the medical side. And then on the dental side, we have a full-time dentist and a full-time dental hygienist, and a couple dental assistants and an oral health educator. Then we have the front office staff. Everybody's been really great to work with. The culture here is, I've worked in a lot of different places, and this is probably the most relaxed atmosphere I've ever worked at. Everybody does a really good job of making sure the patients get seen. And this is our baby scale and our scale right here. We have 8 exam rooms, and we can actually go in this room and set up like a normal clinic operation would be, and we use electronic medical records for our computer system and our chartings for each of the patients. provider office where the providers do their work and they're not seeing patients. This is our nurses station. This is the brains of the operation. These girls keep the providers in line. These are our dental operatories. We got 3 operatories for dentist and dental hygienist. We just added dental services in 2009, and Dr. Minia is very busy. And everything is digital over here, from digital x-rays to you know, the molds that we form and everything. Everything is just the best that we can get.
Sounds like all in all you have a very busy schedule here for the most part.
We are keeping very busy, and we're always looking for new patients, and we've got the time.
Brad, what would you say the #1 health concern is at UCHC and in healthcare in general?
Well, I think healthcare in general is just being, you know, chronic disease such as diabetes, high blood pressure, hypertension. The way that our lifestyle is right now, with the way we eat and the way we, you know, lack of exercise in our everyday lives, those are the biggest issues right now. The generation being born right now, and this is so for the last 5 years, is the first generation that will not live as long as their parents. You know, I'm 36 years old. People my age, we're supposed to live to be 83. The kids that are 5 years old and younger right now, the last study I've seen is they have a life expectancy of 70. So just in the last 20 years, I mean, the lifestyle and the mortality rates have dropped significantly, and that's because of the diabetes rate, hypertension, and just the way that we're just not taking care of ourselves. And so that's the biggest struggle for healthcare right now, is how do we be more proactive instead of reactive? You know, as a clinic, you know, we want patients to come and see us because that's how we make money, that's how we, you know, that's why we're here. But we really want to do more of a proactive approach. We have a full-time social worker here that actually meets with the patients and offers them education or gives them information that they may not get somewhere else on, you know, maybe refer them to a dietitian or a nutritionist or get them into a diabetes class. And so we're trying to be more proactive, but you know, the way the healthcare system is set up right now, it's just not beneficial for clinics to take that approach.
Yeah, that's right. And you said that the new medical director and nurse practitioner are now on hand, so it sounds like that's going smoothly. Any other goals, anything else you're looking forward to coming up here at United Community Health Center?
For the most part, my main goal right now is just stability of the staff. Over the last year, we've had some turnover, and we've had new providers in and out, and so you know, with myself being new, we've got 2 new providers. I think we want to make sure that our staff are stable, our medical providers are stable, and we want to welcome those patients that have come and seen us in the past, but have moved on because of our instability with our providers. So that's our main thing, is to get those patients to come back to us, but just be stable. And we really want to work on a more proactive approach, helping our patients learn more about their chronic disease models. And I think our social worker, Cheryl Lyons, I think she does an excellent job, as well as our nurses and providers, on educating the people about their disease and what steps they can take to help mitigate the progression of their disease.
Well, all the best moving forward. That is Brad Meyer, the new Chief Executive Officer at United Community Health Center in Storm Lake. Brad, thanks a lot for your time.
Thanks, appreciate it.